So a lot of people with low back pain understand that tight hamstrings can pull on that fascia in your lower back and create that pain, but that's not really the whole story. So let's take a look at what's really going on down the chain of events here that lead to low back pain. First of all, as Americans, we're always in this position. We're seated at work, at school, driving, on the couch, and when we're in the seated position a lot, my hip flexors here are shortened and we don't get good blood flow, we don't get good oxygen delivery to those tissues, and we start to get hypoxic. Everything gets sticky and it doesn't move as well. So my hip flexors are not being recruited as they should. We have what we call reciprocal inhibition. What that means is our central nervous system, if these muscles do not work right, our nervous system is not going to recruit its opposite muscle, the gluteus maximus, which is very essential for human movement and hip extension. So if my hip flexors are tight, and my glutes aren't working well, now my hamstrings have to take all of that load trying to get me into hip extension, and the hamstrings get tight, and that's what pulls on your lower back. So when we think about low back pain, it's not just about stretching out the hamstrings. That's not going to solve the issue. What we need to do is lengthen and relax the hip flexors and activate the glute muscles so that we can get a better force-couple relationship and have that hamstring do its job of helping and not being the prime mover of hip extension and getting tight and pulling on all that fascia. So let's go through some exercises on how we can accomplish this. Okay, the first thing we're going to do is a couch stretch. I'm using a bench here. You can use a wall, you can use a couch at home. I'm gonna take my back foot, put it up onto the bench. The closer my knee is to that bench, the more I'm going to feel this stretch. The other foot is gonna come right here in front of me, so I'm in a half kneel position. From here, I want to feel the stretch right here on the front of my hip. So this is for the hip flexors. Want to get a good stretch there, I can activate my glute and squeeze, work on activating that muscle for hip extension. This is perfect. If you sit a lot, you need to be doing this stretch. So an essential exercise for hip extension is the glute bridge. And today I'm going to use two different bands to show you how these can be great tools for activating some other important muscles. So the first variation, we're going to take the smaller band, bring it around my legs just above my knees here. This is going to help me activate the gluteus medius muscle, which is an important hip stabilizer in the lateral plane of motion. So I'm coming here to the ground. I'm going to raise my hips just like in a normal bridge, but I'm also tensioning the band by pulling my knees apart, and that's going to activate that gluteus medius muscle. This is great for lumbo-pelvic hip stability. Version 2, I'm going to use the longer band here. I'm going to change my angle here so you can see what I'm doing. But this time I'm going to hold this band in my hands. This is going to help me to activate the lat muscle. When you activate the glutes and lats together, those muscles pull in opposite directions to stabilize the sacroiliac joint right in between your hips. So for this exercise, same thing as before with raising my hips up in that bridge, but I'm also going to tension the band by activating my lats and raising the band above my head. So I'm doing two motions at once. I'm bridging at the hips by squeezing the glute, and I am tensioning the band and raising above my head, activating those lat muscles. This is a great exercise if you sit a lot. This is very, very important. All right, so the main point of all of this is it's okay to stretch out the hamstrings, it's okay to stretch out the back, but if we really want to fix the root of the problem, we need to sit less and we need to move more. See you guys.